The Save American Workers Act has passed the U.S. House of Representatives. This title of this bill is not intuitive. It really should be called the Don't Penalize Employers for Not Providing Quality, Affordable, Comprehensive Health Insurance to Their Employees Act. We're going to talk about the history, the employer mandate, and what's next. So this bill, the Save American Workers bill, is the latest attempt to repeal parts of the Affordable Care Act. We've seen a barrage of attempts to chip away at different parts of the Affordable Care Act, and even a lawsuit in Texas to swipe the whole thing. This particular bill has made it through House committees, and it wants to change the IRS code definition of full-time employee in that employer mandate section of the Affordable Care Act. Now, in the past, full-time employee meant somebody working at least 30 hours a week on average. The definition, as proposed in the new legislation, changes that to at least 40 hours a week on average. Now, there are other things in this bill as well. It wants to retroactively suspend penalties for employers that aren't providing insurance, those employers where this mandate attaches to, and it's not all employers. We'll talk about that in a second. And it also wants to delay the implementation of the tax on high-cost employer-sponsored insurance, and we know that better as the Cadillac tax. So that last point, the Cadillac tax, kicking that down the road a little longer, that's actually a bipartisan idea, and that's nothing new. But the retroactively suspending penalties for employers that don't comply, that is new, and that's where the money is. We'll talk about that more as well. But let's refresh our memory of what we mean by the employer mandate. This is language in the Affordable Care Act. It's part of that individual mandate that everybody has access to insurance or pay a penalty. And in that language is the section that it says if you're a large employer, you don't have to provide insurance. There's not a requirement that businesses provide health benefits to the workers. But if you are one of the employers that qualifies as a large employer, which in the original bill meant more than 50 full-time workers, then you could face penalties if you don't make affordable coverage available to your workers. And the coverage then needs to also meet other thresholds. Coverage needs to meet minimum value and affordability standards. Well, this mandate has been delayed many times. So there are companies out there that have more than 50 employees that are not providing quality insurance, and they are not facing a penalty because as things got negotiated over time, it actually was slowly implemented by 2015 to have an employer mandate, and then it attached only to large employers with over 100 workers. So it got a little adjusted over time. The Congressional Budget Office did some estimates at this time saying, that penalty on those employers that weren't providing quality coverage with this metric was a lot of money. This is a revenue stream to fund actually other parts of the Affordable Care Act. And it was at that time over $207 billion over the next 10 years. So these critical pieces of the employer mandate, the penalties on employers not providing insurance, equals a lot of money. That money is then used to pay for the rest of the Affordable Care Act. Think of if you had the Cadillac tax there and there as well. That's where money could be redirected for things like Medicaid expansion to states. So let's look at the impact of this particular bill. The Congressional Budget Office issued a new report, an impact statement. It's one page, and it just shows the math. And it breaks it into those elements of the bill. The retroactive suspension of the penalty on employers back to 2015, and that's $25.9 billion through 2028. The impact of the definition change alone, $9.8 billion. The impact of the tax delay, kicking the can down the road on that Cadillac tax, $15.5 billion. And some are saying this is an incentive, once again, to switch up how employers categorize their employees. If you're going to be moving them around part-time to full-time, what that looks like. So there's a little bit of disruption that goes along with this. The Congressional Budget Office report overall said direct spending and revenue impact of this bill alone is $58.5 billion over the next 10 years. That's a lot of money. And like we said, it left the House Rules Committee. It went to the House then for a floor vote where it was indeed successful, 222 to 171. Where does it stand now? Well, it's now up to the Senate to take it up, and they have not yet done so, and you can bet that's where there's going to be a little bit more discussion because people don't like to lose revenue streams. The federal government doesn't like to lose revenue streams, and this is a big one. But you have to balance that against the political rancor around the Affordable Care Act. So that's something we will follow and bring that to you. You can read the bill itself, the Save American Workers Act. You can decide if the title matches the language. You can read that new Congressional Budget Office report, and you can also visit a couple articles that have been talking about this lately as well. You can share your story or visit more of our videos at healthwatchwisconsin.org.